Well, healthcare has been a major topic of discussion during the provincial election campaign, with a number of party leaders putting forward some plans in recent days, including a focus on the country's family doctor shortage, and specifically Ontario's. Joining us now to talk more is the president of the Ontario Medical Association, Dr. Dominik Nowak. Dr. Nowak, appreciate your time this morning. Healthcare is certainly one of the big issues the Liberals and New Democrats are, sort of campaigning on in this campaign here. Let's just talk about the doctor shortage just generally in this province here. We saw those lineups in Walkerton a couple of weeks ago, thousands of people trying to get a family doctor. How dire is the shortage here?
Yeah, I'm calling it a Hunger Games. Right now, nearly 1 in 4 people across the province can't find a family doctor. And look, I was meeting with many of these folks over the last few months and years as a family doctor myself. If you can't find a family doctor, you're using the emergency department more often.
Yeah.
You're missing cancer screening, actually costing the healthcare system more money, making it less sustainable in the long run.
My understanding, too, is that a lot of doctors, unlike yourself, are choosing not to go into family medicine and going into more specialties. What is turning doctors away, or medical experts away, from just being a family doctor, as it were?
Yeah, and we need our family doctors. The reality is, for many medical students, new graduates, it's not seen as a viable career choice or business model in Ontario. And that's because we haven't modernized how we care for patients and the funding models behind family practice. They're still there from years and decades ago. And meanwhile, people have gotten more complex. Aging, population growth. That's why we really need to update our funding models urgently to get everybody a family doctor.
So funding is key, modernization is a key, doctor. Are any of the there's 4 major political parties in the province, are any of them putting forward a platform that lines up with what the OMA is looking for in terms of funding and modernization?
Look, we're seeing some important things from most of the major parties. What I would say to voters, to Ontarians, is vote for who you trust to get our healthcare system back on track. Right now, people are reaching out to the healthcare system and not getting what they need. It's causing harm. It's causing delayed diagnosis. It's causing overwhelm in hospitals and emergency rooms. But we could get our system back to a place where we're proud of it again. It's going to take political will to get there.
I think one of the things, even as an anchor who sort of follows this on a sort of semi-regular basis in the news, there's a lot of numbers thrown around. The New Democrats, for example, they're campaigning on about $3 billion in healthcare spending. The PCs about $1.8 billion. You know, throughout their tenure, the PCs have talked about spending this on healthcare, this on hiring nurses, this on hiring doctors. It gets a little overwhelming. Does the OMA sort of put forward a bit of a filter to let people have a sense of this is what this might mean, or this is what we actually need?
Yeah, so we're advocating for smart decisions and smart funding around healthcare. So I think of what would make a difference to getting everybody connected to family practice. It's building out teams. That means doctors, nurses, pharmacists, all sorts of health professionals working together. It's cutting back on the massive red tape and bureaucracy in our healthcare system. And it's going to come down to modernizing funding for family practices so that family doctors see family medicine as something that they're inspired to do. It's something that they're supported by the system to do.
It's interesting. One of the things I hear time and time again from different doctors we interview, especially family doctors, is the paperwork and the administration side of things, and how much that takes away from a doctor's ability to actually treat patients. And really, I suppose that's really the point of the healthcare system, to treat people rather than to do paperwork. Are there any ideas on the table about modernizing that side of practicing medicine, the sort of admin side, quite frankly?
Yeah, and the paperwork, it sounds like it's an administrative big deal, but it really is a matter of life and death. I'm a family doctor myself. The reality is we do 19 hours per week on unnecessary red tape bureaucracy in the healthcare system. That's taking us away from caring for patients. There are things like AI Scribe, right? So AI Scribe already in our studies is found to cut down around 4 hours per week on family doctor time. That's time that we could use taking care of patients.
Right. Okay. Well, it's going to be really interesting to sort of see where Ontario does decide to go on February 27th. Dr. Nowak, appreciate the time this morning.
It's my pleasure.
Thank you for being here. Appreciate this.